Anthony Chadwick from the Webinar Vet, welcoming you to another episode of VETchat, the UK's #1 leading veterinary podcast. And I'm super excited to be chatting to the team at Oxford Cat Clinic. I was lucky enough to go here probably, 4 or 5 years ago. It's definitely pre-pandemic. I mean, a lot of stuff has happened since we probably saw each other at the clinic. But Caroline, tell us a little bit about the history of the clinic. I think it must have been one of the first ever cat-only clinics.
Yes, it was a very early one. There were others around when we opened up, but the origin, I guess, is that Martha and I are of an age where most vets graduated and went into some kind of mixed practice. And during that experience, we realised that at that era, cats were a bit neglected, beginning to emerge from the dark on the science side of things and why they were different and how they were different. They weren't just small dogs, and that they were perhaps a bit neglected in first opinion practice because we didn't realise what they needed. So Martha and I both met actually at the University of Bristol under Tim Griffith-Jones doing feline medicine speciality, and that was fantastic. But these were a fellowship and a residency that lasted 2 years. Then we spun back out into the big wide world with all our knowledge and realised it wasn't very easy to apply it in general practice in the way that we wanted. And we'd seen how well cats flourish, especially when they're poorly, in an environment that's catering to them. It makes a big difference. And so we decided that we would join forces. We both, by coincidence, ended up in Oxford and thought, what an opportunity to join forces and create the practice where we feel cats and owners can flourish, because we also realise that cats spot cat people and cat owners spot cat people as well. And it's just a happy environment. And that's the origin, really, of the Oxford Cat Clinic.
And presumably both fab scholars.
Martha was a fab scholar, that's right. Now, I was, at the time, I think this company's gone now, Fort Dodge Feline Fellow, so more in education, research and working in the laboratory at Langford, but totally immersed in cats and under the tutorship of Tim Griffith-Jones and Andrew Sparks and Sarah Caney and really good people like that. And so just got thoroughly immersed in the feline world and feline medicine and what makes cat welfare and care better.
I think Bristol was definitely the Pussycat University, wasn't it?
It was, yes. Well, I say it was, but still very, very good.
It still is, yeah.
But the Feline Centre was a real mover and shaker, I suppose. And again, it spun off people like Danielle Gunmore, who's gone on and done great things up north, so in Scotland. So, it was a great time to be there.
I suppose people who are, should we say, a bit younger than you and I, FAB was Feline Advisory Board Clinic. And for those who are a little bit younger than us, yes, you did hear it right. Certainly when I qualified, a lot of vets did think that cats were just small dogs. And I remember, I think it was the BSAVA book, which was written by Tim Griffith-Jones, wasn't it, that started to really differentiate, this is a different species and we have to look at it differently.
Yes, and it's hard to remember now because it's advanced by leaps and bounds. And of course, ISFM, who've come from FAB, have done so much to promote the standing of cats in all sorts of ways, but how we look about their environment, their standing in society, and particularly their medicine of cats, huge influence. But that all seemed to arise from this core body of people and from Tim's work, really lifting the lid on all of that.
He must be very proud, and obviously you as sort of early people at the place, that you see that that's actually spread out, because the whole point of education is that we are open and that we want to spread that knowledge. Part of Webinar Vet was to make veterinary education more accessible, affordable to vets across the world. And if we can educate other vets and other nurses and they become better, then animal welfare for cats not only is great in Oxford, but it's also great in Liverpool, it's great in Leeds, Newcastle, in Europe, in Africa, in Asia, and across the world. So, thanks for everything you did. And I think that history lesson is really important for those who perhaps are 5 to 10 years qualified, who perhaps don't know anything about that. I know, obviously, you take education really very seriously. I think both of you, you and Martha, who set up Oxford Cat Clinic with you, have done webinars and things for us. So, thanks for all that support. And I know the practice is very much built on educating the vets and nurses that come into contact with it as well, aren't they?
It is, and I think actually the lovely thing is now that we've been established so long, and because we have the first opinion and the referral streams, and because we have specialists and just purely first opinion vets and nurses that are very well educated in feline medicine, they've got a passion for it. There's a great synergy. It's like a pool of cat wellness in a way, because so many people know different aspects, and the nurses have done a lot of work in behaviour, and they're great with the cat friendly clinic aspect. You can get too tied up with the referral medicine and intricate cases, and it's really good to have that global spread where there are still people saying, hey, we could do this better, we could do that better. Have you thought about how the clients feel when they come in? Have we thought about what the waiting rooms are like for cats? Which is just as important. But also, the people are bringing in this education and knowledge, and we talk about cases and try and have protocols that focus on certain specific diseases and how to handle them. Um,
And I know the nurses are very involved in those as well. You have specific nursing clinics for specific diseases like diabetes. Steph, obviously you've been a nurse at the practice for a long time. Tell us a little bit about those clinics and some of the great tools that you have to sort of do the work that you need to do. I mean, again, going back to the 90s, Caroline possibly was, but I certainly wasn't, monitoring blood pressure on cats, and we now realise how important that is. So, yeah, tell us a little bit about your journey to Oxford Cat Clinic.
Certainly, blood pressure is extremely important. I moved from Kent to join the cat clinic. I had worked in a practice that wasn't cat friendly, and I'd spent 3 years getting them cat friendly accredited. And I really saw the difference that it could make and the impact that it could have on cats coming into the practice. And I just wanted to take it as far as I could. So, but I applied to work at the cat clinic, and the difference is remarkable. Seeing them in their own environment without dogs, without the stress of loud noises and just things to
Yeah.
disrupt them, they're so much happier. And it's really given me the opportunity to keep studying. I've taken a certificate in feline nursing, then I've gone on to do a certificate in anesthesia. Pain control is really important in cats, and it's something I'm very passionate about. I
And I know you
also,
do some acupuncture as well, don't you?
yeah, so I studied acupuncture in 2016, and it makes a huge difference to cats, particularly older cats, where they can be on a lot of sort of non-steroidals for arthritis. Having that combination of acupuncture and pain relief, it means you can lower the pain relief doses that you're giving, and they're not having that impact on their kidneys as severe as it could be. So it really, it's, as Caroline said, it's that multimodal approach to each case that we look at all aspects from how they live at home to what's possible for the owner to achieve and the temperament of the cat. And it's that very tailored approach that I think makes each cat very unique. We find what works for them.
Um, I was adopted, as I was saying, by a cat, and he's actually got so clever. He was writing emails recently, hacked my account. I mean, I'm going to ask a question. I think I know what the answer is, but I'm going to ask it anyway. Who's the more intelligent, cats or dogs?
Oh,
Steph,
it's got to be the cat.
Caroline.
Very stoic about it.
Yeah, I think dogs can be great pals, but cats are the ones that have a critical kind of conversation going on with
Yep.
you and
Yes.
are training you.
Well, I'm definitely on the staff, and he very much tells me what he wants when he wants it. He's gone to sleep. He occasionally comes across, but I think he's asleep, so he shouldn't bother the podcast. And interesting, you were talking about that. Now a 17-year-old cat. I remember one of the first series we did with Hills, actually, and it was Duncan Lascelles was talking about what is the most common disease in cats. And obviously, as a dermatologist, I kind of wanted it to be that. And then the dentist wanted it to be dentistry. But actually, virtually every cat at 17, will have osteoarthritis. Amazingly, he still jumps and leaps everywhere. I've taken the approach of getting him on Silencia. What's been your feeling with that? Is that a drug that you've enjoyed using in the cat clinic? But maybe go on,
Absolutely.
Steph. Give us your impression on it first.
We actually had one of our nurses that was sort of interviewed by them, and they did a nice little summary of her cat and how she's progressed using Silencia.
Yeah,
I think there's so much about it that we still don't know yet of how much it can help them. But certainly with arthritis, I have an 18-year-old cat, and he's on it, and it makes a huge difference.
and obviously, if you can avoid the non-steroidals with the potential kidney disease, which again probably at 18, most cats will have some sort of kidney dysfunction, won't they? So,
Mine
Caroline,
certainly does.
what's your thoughts on it?
Yeah, I think it's a great addition to the arthritis toolbox. And for some cats, it's absolutely the answer, and for some owners as well, because one of the things we're very aware of is compliance, and we're always looking at ways to
Yes.
make the owner's life easier. And especially in old age cats, often they've got comorbidities, they're on polypharmacy, and you don't want to destroy a beautiful relationship because the owner's trying to give them Metacam and all sorts of other medications. So with Silencia, another very important aspect of it is that just once a month injection, and then it's
Yeah,
done, and they can go on being just your pet, and you can go on being just their owner rather than their carer for the rest of the month. And it's I think we do try and look at all different aspects. We don't have one fixed cure for one thing,
yeah,
but
of course.
Silencia is really important, and obviously used alongside things like acupuncture, diet, anti-inflammatory diets can
Hmm.
be really, really helpful.
And is that something when they're coming in? Is that something that the nurses will tend to do those monthly injections, or do the vets get involved in that as well?
We tend to have the vet obviously will prescribe the first injection.
Yes.
Then they might have a follow up with a nurse in a month's time, and then the third injection would be with a vet to check, and just see how they're
Yeah.
getting on. So it's really we both work together. Vet's time is extremely precious, so is nurse time, but there's a lot that nurses can do to free up vets to be able to have more time for clinical work.
Hmm.
So we do have the older cats in, we do the weight checks, we do the blood pressure, all of these things we can do, even routine blood sample monitoring. And then those are fed back to the vet in their own time for calling out labs and things. So it just means having the clinics that we can offer so much more time to the owner that the vet might not necessarily have to discuss things like diet and lifestyle.
Hmm.
Yeah, I think that's absolutely right because time's so precious and
Yes.
pressurized that
Yeah,
being able to know that you've got a really good team around you as well, and that someone like Steph or one of her colleagues will step in and do all those conversations and allow the owners time to ask all those questions that they don't want to ask the vet about. It's
Hmm.
absolutely brilliant.
And this is great when we can work together because obviously there is a shortage of vets and I suppose nurses as well. So if we can use our team well, use tools that will help us, maybe some digital tools, then all of these things can make that workflow more possible. But I know when I went down, I think it was just Botley. I can't remember. I didn't go to Marsden, but Marsden has now opened as well. Um,
That's right.
you have this great situation. It's a 4-day week, which I think there's so much research now going on in just the business world as to how 4-day weeks can really work as well. So I know you're looking for a vet and a nurse. Tell us a little bit about perhaps what your ideal candidate looks like. Maybe Steph, for the nurse first and then Caroline for the vet?
I think that the nursing at the cat clinic it's so well rounded. You really get the opportunity to work in so many different areas and gain experience in so many different areas that it's never a dull day. So I found that being able to gain more skills looking after hospital patients, particularly referral, more complicated patients, is really rewarding. Surgery wise, we do everything from castrations up to
Mm.
invasive abdominal surgery for biopsies and what have you. And then the whole side of referral with endoscopy. There's just so much to learn, and because we take the time with each cat, we don't rush things. We take each case as it comes, and we really spend the time to work them up. You get that opportunity to learn in a really calm environment, and it's just a really special place. And then you get to see the kittens that come in for first backs, and you see them
That
grow up.
lovely mix is great, isn't it? Because we
It
all
is.
love a kitten, don't we?
We do. I mean, most of the time I want to put them in my pocket and take them home.
Mhm.
But it's that beautiful mix, and being able to see them grow up through the clinic. Um,
Mm.
as Martha and Caroline have, they've had cats come in as kittens that they've seen through their whole life, and
Yeah.
and it's a very special place.
Having the referral and the first opinion, the referrals I used to love doing as dermatology, but it was also nice to just have, as you say, building up those relationships with people, who came in with their first vaccinations for their dog or cat, and you followed them through for the next 10, 15 years. So yeah, no, it makes the job really special, doesn't it? Did you know the Webinar Vet has a public community Facebook group? We want to ensure veterinary professionals have a place to stay in the loop with everything that's happening here at the Webinar Vets. In this public group, you can chat and network with other veterinary professionals from across the globe, get exclusive updates, content recommendations, and so much more. Pop and say hello to a community of over 2,000 veterinary professionals by searching the Webinar Vet community on Facebook. Caroline, I know obviously yourself, you're an advanced veterinary practitioner in feline medicine. You're also a member of the Australian and New Zealand College of Veterinary Surgeons. Martha, obviously diploma holder and specialist. And I know you've also got, I think it's Eleanor and Lauren also working in the team as well.
That's right.
So this person who would come in as a vet is going to be more on the first opinion or on the referral side?
I think predominantly what we're looking for is someone to support the first opinion side, which actually is a great passion of mine because, like Steph, I love that cradle to grave progression
Yes.
of things and knowing the cat through their life. And yeah, so we run a lot of clinics. Most of our work is first opinion. I guess really we're looking for someone who's got an interest in cats, possibly a passion for cats, but is a great team player because there's so much to learn from. So someone that works well with the nurses and can use their knowledge and with ourselves. And we do work very much collegiate style. So if a first opinion vet has a particularly challenging case, if they've come to a point where they think I just need to internally refer this and you look after it, they can do that. But if actually they think I'd love to do endoscopy or the ultrasound, then they can work with us and we'll try and improve their skill set as well. So it works very, very nicely like that. And then it goes back to them to continue the case and we're there as a pool of knowledge. So we're not looking for someone to join the referral set particularly. It is to have that passion for the first opinion side, for client care, who enjoys working with clients, enjoys working with their nursing team, and loves cats. And most of our cats and nurses are quite cat passionate, but actually we have some that are very, very good professional vets and vet nurses, very happy with dogs and other animals. But I think cats are so curious. I think they constantly present different aspects, different faces, because they're quite subtle to diagnose. The more you look, the more you find with cats. So someone who enjoys that kind of medical journey with them. But we do surgery as well, so someone that's competent in surgery would be a wonderful addition to the team. But there's lots of opportunities to grow or to come in and
I
slot
think
straight into the team.
as a vet or as a nurse, we have to be lifelong learners because I qualified 33 years ago, and if I was using that knowledge now, that would not be
Mm.
very good at all. And so, if you're working in a place that one encourages, CE, CPD outside of the practice, but actually a lot of our continuing education very much comes from within the practice when we're discussing cases with colleagues. And I know, you're very keen on doing that, as you say, with the more challenging cases, and presumably even the referral cases. Often you're in the coffee, the staff room. You'll be discussing, all sorts of cases, won't you, in those coffee periods?
That's right. And then we'll try and have a focus session on something like how to. We're focusing on chemotherapy at the moment. What are the best ways? What are the best tools to use? Obviously, lymphoma in cats plays a big role in that. We're trying to pool all the knowledge. Lauren, having come from America and with the different circumstances over there, has got a slightly different pool of knowledge to someone like Martha and myself, who've been working in the UK for so long. But using all this time together and very much involve all the first opinion team in those discussions, because that's where all the cases arise from. So in some ways, the division between referral and first opinion is slightly an artificial division, because all referral cats start as a first opinion cat, and we're just lucky enough
Yeah.
that they can run up and down the level of experience in our clinic without having to leave the premises. We do refer out. Obviously, we don't have a CT scanner. There are other people, dermatology, Andrew, Anthony's rather. There's a particular thing where I struggle, to be honest, because I don't see many dermatology cases, and I'd love the input of a dermatologist, and we're very happy to look outside the practice for those kind of things. But there's so much knowledge within the team as well.
Yeah, fantastic. And just perhaps to finish, moving to Steph first. The nurse who's going to apply for this job obviously presumably need to be an RVN to start with.
Yes.
But what other skills do you want a certain number of years qualified? Um, do they need to live in the local area, or is the ability to sort of help them to settle into Oxford if they chose to come?
Um, I think in terms of the package, Caroline would need to answer that one. I have to say that the nurses that have been with us longest, myself included, we really did see the job as a lifestyle change, and we
Yes.
moved, to fulfill that goal. We also had a nurse that moved from Ireland for a number of years. So they're very supportive in helping people to relocate, and find a way to move your life to the local
Yeah.
area. Um, in terms of number of years qualified, we've had a whole range, and everybody's fit in really well. So we've had from sort of a year to 2 years qualified that are really keen to increase their knowledge. You don't have to turn up being the perfect cat nurse. That's not the point. We want to encourage you to learn and teach cat handling, and teach you the intricacies of the tiny complicated cat. So I think it's as Caroline said, anyone with a passion for cats that just has that itch to learn a bit more.
Mhm. And Caroline, obviously, whoever applies has to be MRCVS registered as a vet. Can work in this country, obviously. But is there anything else that you're particularly looking for? I think you've said, you have to like cats, and you have to like people, and you
Hmm.
have to like nurses. If you do those three things, you're probably going to be all right, aren't you?
Yeah, absolutely. I mean, I think it reflects really what Steph has said so well, that someone that comes in with an open mind, a willingness to learn, a willingness to work as a team, and interesting cats, they'd fit in very well. They do work. They will be working at Botley, which is the more established clinic and currently where the referral work is held, and so you can learn a lot there, and you've got colleagues around you. But also, 1 or 2 days a week, you're likely to be working at the Marston Clinic, where sometimes you're working solo as a veterinary surgeon. You obviously have probably a very experienced veterinary nurse working with you, and a receptionist, and often an animal nursing care assistant. But a new graduate might struggle there. But often when people start with us, we'll start them predominantly at Botley, so they get into the way of things and learn about what our ethos is, learn about cat handling as well, because it's a different tempo. We had a student this week who's been lovely, but he said it's quite different. What are the different things? And one of it is the tempo with cats. You can't race things, you can't force things, you have to work with them. The nurses are wonderful at teaching that. So
How long are your consultations, Caroline, for the first opinion?
They're 20 minutes as a rule. If we know we're seeing a senior cat, they'll get 30 minutes. If we know that we've got something that's going to occur in that consult, such as blood pressure or a blood test, then it's 30 minutes. But the routine appointments are 20 minutes.
And that gives, I've always said with the dermatology, when I was doing that, obviously I knew a bit more about dermatology than probably the person who referred it, but actually the biggest gift was just having a full hour, as I did, with the clients. And often, if you take the good history, actually, the diagnosis is often, you have an idea what it is even before you've touched the animal. But that history is so important. And as you say, you can't rush that, and you can't rush cats. Cats will work at their own pace, won't they?
Yes, that's right. I mean, funny enough, it's an area we've been talking about, rather than doing a series of 30-minute consultations. If you've got a really poorly cat, have a conversation with the owner and perhaps suggest having an hour-long consultation where we really do a holistic approach. Might be better than jumping day to day. And that's, of course, what happens with the referral. So that's a very comfortable fit at the cat clinic to be able to introduce that aspect.
And if necessary, you can obviously admit an animal for more tests, and that they come
Yeah.
back later to pick up the cat. So there's that flexibility. And sounds, obviously I've been down to Botley a number of years ago now, but I love the work that you do. Part of Webinar Vet's vision is to have the world's most confident vets, and we do that. They've got the best education coming through. They commit to learn. When you walk into a consulting room, you feel more confident that you can sort the problem out. And let's face it, despite some of the negative press we hear, for me, I still, if I could go back 30 years, would still want to be a vet. And I think nurses kind of on a similar level as well, although I've never been a nurse. It is one of, if not the best jobs in the world, isn't it?
Yeah. The great thing about cat nursing is there's no heavy dogs, and it's all calm and quiet. My back will last another 10 years, I think.
But I would highly recommend people who maybe want to change into a cat clinic to really consider Oxford Cat Clinic. I love the idea of the 4-day week. Again, and I know, Caroline, you're a bit younger than me, but we did a lot of on-call in our day, and I know now there's also an on-call clinic that looks after the emergencies in the evening. Although, because you are a referral unit, you will have cases that you sometimes keep in overnight if that's for the best welfare of the cat. And I think that's so important that we always place. I always talk about the triangle. In fact, I've turned it into a square now because I want to look at environment as well. But that relationship between the cat, the vet, and the owner. And I've always said, whenever I was doing consults, the most important person in the room is the pet, isn't it?
Yes. That's why you're all assembled there together, is for that cat.
Yeah, we're all working to try and make that, improve the cat's welfare and its health, of course. We've not mentioned it. I mean, it kind of can be taken as granted that you're an ISFM member, and of course, both clinics are gold cat-friendly clinics. ISFM is such a good charity. It does such great work, and the conferences are always good. I know you're missing this year's, Caroline. I will wave at you from Dublin over to Oxford. So look out for it. I'm quite tall, so you might just spot me. But I'm looking forward to seeing Martha there, and
Yeah.
I do hope you have success. This is a practice that whoever goes to it will be blessed to be in it. So I'm looking forward to hearing good news from you next time I speak, Caroline.
Oh, thank you so much. It's been
And
really
Steph,
lovely to
great,
talk about
great
it.
to chat as well.
Thank you so much, Anthony.
Thanks, everyone. Thanks for listening. A potpourri there of interesting stuff around Buddy, around Silencia, around all the things that we can do with cats if we give them a bit more time and don't rush them. It's, as I've said, a clinic that I would highly recommend. And as I say, looking forward, hopefully, to seeing you both soon. And who knows, if I'm popping past in the Oxford area, I'll come in for a coffee.
You're always welcome.
Take care. Thanks, everyone.
Take care.
Bye-bye.
Thank you. Bye bye.